or 8 weeks or something like that. Because it uses different chemicals and it's not as harsh and it doesn't burn your scalp, that's where it's supposed to be better. I have still read quite a bit, though, about people having problems with those too.
Have you seen any of your clients using it?
I have not. I have not seen any of my patients using it. Okay.
Excuse me.
Oh, sorry. Go ahead.
On hair coloring, what's your recommendation on hair coloring?
I don't mind hair coloring. If you have a problem with hair coloring, it's typically related to an allergy to the active ingredient. In dark hair colors, the active ingredient is called paraphenylenediamine. And the way that you know that you have an allergy to that is that you develop a rash, typically around the hairline and on the ears, that lasts for several days, maybe even a week after perming. If that is the case, then what I suggest is that you go with an all-natural, organic, usually vegetable-based hair dye. Sometimes they'll spell out paraphenylenediamine on the label, sometimes they'll put p-phenylenediamine, sometimes they'll put PPD. Whatever the case may be, if you see that on the label and you know you have a problem, it is something that you should avoid because, again, if you are allergic, it's going to cause inflammation, which is going to lead to hair loss. Right?
Does color break your hair off?
No, not necessarily. A lot of the colors actually have moisturizers and conditioners, so some people do very well with the color forever. I hope to God I'm one of those people, so I don't mind that. Go ahead.
Since last November, I've been using a product line, and I'm not a commercial, but Win.
Oh, sure.
And, you know, it doesn't lather, and
right.
I don't know.
The reason that it doesn't lather is that it's sulfate-free, which is becoming a big thing. That all of us are conditioned to think that we need that wonderful, luxurious lather in order to get our hair clean. In fact, what's happening with those sulfates is that they strip the skin of the hair of so many of the oils that we are supposed to have, that over time we end up with damaged, unmanageable hair. So sulfate-free is and no lather is a big thing. You'll find that with my product line next year too. Okay. Okay. So what happens when you come to me if you are having thinning of your hair? We will almost always check blood work. We've talked mainly about hair loss related to styling practices. But hair loss can also come as a result of underlying problems. So we will almost always check blood work on you to make sure I'm not making an assumption and missing a problem, for example, with your thyroid or iron deficiency anemia or something like that. We will do prescription topical steroids to control any dandruff or inflammation in your scalp. We may do steroid injections. Now, this is not the kind of steroid that gives you big muscles and gets you disqualified from the Olympics. This is an anti-inflammatory, so it should do a very nice job of helping us. And it also does stimulate the growth some. If you need to buy something right this second, Rogaine or Minoxidil is the generic name for it. Minoxidil does work well. It can cause a lot of itching and inflammation. It's not without some potential for side effects. So if you develop any itching, swelling of your extremities, your hands or feet, palpitations, any of that, you want to discontinue it immediately. And just so you know, the 5%, which is the extra strength for men, works much better than the 2% for women. Just be aware that if you're using it, you can have hair grow other places. I don't mind telling you that the whole reason that I started my product line was that my hair started coming out when I was about 25. And this is something that affects every woman in my family. My grandmother, whose hair was almost exactly like mine, died at 91 with about 10% of her hair. And I am not joining her with 10% of my hair, so that's kind of how this whole thing got started. But when I was using Rogaine, not only did I grow hair on my head, I had hairy arms, and my husband was shaving my face. And I sent out this Christmas card that I cannot believe I sent out, where I had eyebrows that looked like caterpillars. So the good thing with mine is, since it's all natural, we don't see that happening. Go ahead. No, of course not, no. So Minoxidil was originally a blood pressure medicine. And when we were giving it to patients systemically to lower their blood pressure, the patients started growing hair all over their bodies. So, being entrepreneurial, Minoxidil was developed, and that's kind of what happened. There is some systemic absorption with minoxidil, and that's why some people experience the swelling of their extremities or palpitations, or in my case, hair growth all over the place. So anyway, hair transplants are an option. I have to tell you, in people of color, they're a little bit tricky. I've seen mediocre results, and the trick is that the curl of the hair makes it difficult to transplant well. But it's something that we are working on and perfecting now. And then in the future, I think this is about 10 years down the line, what they're working on right now, research-wise, is that they're taking your hair, cloning it, and then transplanting your own hair into your scalp. But I think that's still about 10 years away. Okay, so from one extreme to the other, help, I'm losing my hair, and then the next thing is, wait, help, I'm growing a beard, you know.